Hi guys, my name is Nada Shami Meti Ismail. I am student of Year 2 of Medical Imaging. My number is 082112. Welcome back guys. Another day, another image critic. So I'm going to do a Paceman method on the spine, which is ap cervical. So for the positioning is, the first one, spinous process aligned with the midline of the vertebra and equally spaced. However, it's demonstrated within its vertebral body due to the central angulation was insufficient and directed parallel with the intervertebral disc space. The second one is mandibular angles and mastoid are equidistant from the vertebral bodies. The third one is pedicle and articular pillars are symmetrical, demonstrated at the lateral side of the cervical bodies. Next is the intervertebral disc space opens. Next is the mandible is superimposed with the third cervical vertebrae because the chin was tucked too far downward. To correct this position, increase the degree of centering point angulation. To correct this position, increase the degree of the central angulation and elevate the chin until the lower surface of the upper incisor and the mastoid tip is aligned perpendicular with the eye arc. So I move to the alignment. The first one is SJ tube and patient. The alignment between SJ tube and patient are not aligned since the center of the collimation does not fall on the centering point, which is at the level of C5 due to the position of the SJ tube is slightly higher. Next one is the between patient and IR. The alignment between the patient and the IR are not aligned because the center of the film does not fall on the centering point, which is at the level of C5 due to the ST tube is slightly higher. The last one is between the ST tube and IR. The alignment between the ST tube and IR are correct because of the distance from the edge of the film to the edge of the collimation are equal for the top and bottom. Same goes with the left and right. At this position, move the ST tube along with the cassette slightly lower until the central beam is on the level of the C5 and directed perpendicularly to the MSP and located at the midline of the cassette. Next, we explore about the collimation. 4 collimation borders are visualized. For superior collimation, base of skull and mastoid teeth should be included at. And for the inferior collimation, at least T1 and T2 need to be included to ensure entire cervical spine is visualized. For the lateral collimation, both left and right of soft tissue of the neck are included within the collimated area. So move to the exposure. The KVP used is adequate within 50 to 75 KVP indicated by the bony cortical outline of the teeth structure, which are pedicles or spinous process can be seen. Next, the thin bony cortical outline of the articular pillar also can be seen. Thus, the contrast of the radiograph is adequate. The image visualized is not over-penetrated or under-penetrated. So, for the MAS, use is adequate. Within 4 to 14 MAS indicated by the bony trapecular pattern of the teeth structure, which are pedicles and spinal process can be visualized. The thin structure, which is bony trapecular pattern of articular pillars, also can be visualized. Thus, the density of the radiograph is adequate. So let's proceed to the marker. A left anatomical marker is identifying on the left side of the patient is visualized without superimposed over the anatomical structure. For the aesthetic, the film size used is correct, which is 34 times 43 cm to include all the required structure within the collimated field. Next, there's no evidence of preventable artifact visualized, such as necklace of the image shown. And for the last one is name. There is no patient's identification including the facility's name, patient's name, IC, and also the acquired on the radiograph. To correct this, place the patient's identification on the top of the left side of the filler without obscure with any anatomical structure.